Hello, today is Tuesday, April 7th, and we are still fighting hard to keep people safe amidst the coronavirus outbreak. With me today is Dr. Amar Garapati, who from Midwest Respiratory. He and his partners are leading the charge here, taking care of critically ill patients. We do have mandatory masking at this time at the hospital, but for purposes of being able to hear us, we're going to take them off. And you'll notice that we are a good 6 feet apart. So thank you, Dr. Garapati, for being here. And under normal conditions, your group would be seeing all the patients in the ICU. But it's not normal right now today. And you're seeing patients all over the hospital. How many patients a day is your group managing?
Just the COVID-related patients, we are probably managing close to 100 patients a day. That would include the intensive care unit as well. But that does not include other sick patients.
Yeah. So we're still taking care of people who have other illnesses in our ICU, not just COVID, but the COVID patients are very, very ill, are they not?
They are. We're getting to the stage when we're seeing more and more sick patients.
Yeah. Well, it's a huge responsibility, and I thank you and the members of your group for being here. I'm not quite sure what we would do without you. So what's it like to be a critical care doctor at this time? Tell us what's different and how you're managing.
Things are changing so rapidly. When I say that, I'm talking about every day. All my members of my group are up late night reviewing the data from all across the world, not just this country, just to see how we can provide the best care for our patients. And it is exhausting, and nobody really knows what the right answers are at this point in time. We do know the basics of, taking care of patients, critical care, supporting them while they're sick, which includes, patient patients on mechanical ventilation or ventilators when we need to. And we're doing all those and also trying to keep up with the latest literature.
It's a big responsibility. So you mentioned ventilators. How are we doing here at Silver Cross with ventilators?
We are okay for now, but we're getting close to running out of regular ventilators. We are trying to recruit machines from the anesthesia department as well, but we are cutting it pretty close.
Yeah, we are. We're getting very close to using all of them. But I do know that anesthesia is committed to helping us in using other machines during this crisis. And is there any special equipment that your group uses when you're perhaps intubating patients or during procedures?
Yes, we take the basic precautions like, your personal protective equipment, including gowning ourselves, gloving ourselves, masking ourselves, including N95s. In certain procedures where we intubate patients, we do wear a special mask called the capper, which basically covers, it's a helmet which covers our head as well as our face, and there's a positive pressure which blows air into the system, tries to keep away, the germs from entering inside the system. Yeah.
Right, and those cappers are precious. We have many on order, but they're not expected until May, so I know you're using them carefully. So the team here at Silver Cross has a command center. We check in on supplies all the time. How do you feel we're doing on protective equipment?
I think we are doing great. Every day, I get, calls from well-wishers asking me about, hey, do you guys have enough PPEs? Do you want us to help? This is from the community. And so far, I think we have been lucky that we have had enough equipment on the floors. And like you said, we check about twice a day to see where we are. Exactly. And so far, things have been working well.
Good. And as you notice, I got this beautiful mask that was made in the community. So the nurses here at Silver Cross who are working in the ICU and on the floors where we're housing COVID patients, they work side by side with you. How are they doing?
The nursing staff has been fantastic. Not just the nursing staff, the respiratory therapists, the people, the custodial service who need to clean up for every patient. They have been working so well together, and nobody's complaining. Everybody's tired, and I couldn't be more proud.
That's nice. Thank you. Thank you for saying that. Any predictions as to when we might? I know everybody asks you that, but what are you thinking?
There's so many different models out there. Some of the models say the peak maybe the middle of this month, towards the end of the month, which doesn't necessarily mean we're going to stop seeing patients. Right. We may reach the peak and maybe not see the escalation we see right now. But I'm hoping it's more middle of the month than the end of the month. But we'll wait and see.
Yeah, well, we have to be ready for anything and how long it lasts. What's your advice to our employees?
Again, the biggest, advice to the employees, people in the community is to maintain your social distancing. That's the best way you can help us, is to stay at home. There's no urgency unless you need to really go out of the house. There's no reason to go out. You can go out for fresh air, but other than that, maintain social distancing. Stay away from, especially the older folks.
Yeah, yeah. Well, I can't thank you and all of your partners at Midwest Respiratory enough for the tremendous work you're doing here. Thank you.
Thank
We'll
you.
put our masks back on.